Hi, everybody. Thanks so much for sticking around with us today. We really appreciate it. This is COS at a Glance. For those of you that typically join us from Facebook, we're usually over in the Welcome Center or in the Corner Cafe, but today we're joining you from the sanctuary and also specifically on the live stream so that we can have a bigger audience, because we've got a really special guest with us today, Jeff Morris. Pastor Kevin mentioned him right at the end of the service, so I don't think I have to go through all of the title again, right?
Right.
But let me just say that Jeff is a professor at the University of Pennsylvania, and he specializes in biostatistics. And he's going to talk in a minute or two about what that means and what he does and why he's here today. I think you're really going to benefit from this today. He's got a lot of great information for you about coronavirus and about how we can keep ourselves safe and what we can do as we move into yellow and green phases and so on and so forth. Before we get there, let me just really briefly say, if you're joining us here for the first time today, welcome. We're so glad you're here, and I hope that you will come back next Sunday for our service and join us again in the future. Thanks for joining us today. And one more quick thing, can I just say Happy Father's Day to all of our dads out there. And Jeff, Happy Father's Day. Yeah, absolutely. Make sure that you hold the mic up so folks can hear you as we talk, okay? So, Jeff, why don't we just sort of get into it? Before we start talking about like all the details of coronavirus and COVID and so on, why don't we talk about a little bit about who you are? Tell us about, yourself. Tell us about how you came to Church of the Saviour, and then tell us a little bit about what you do. And remember to talk in layman's terms as much as possible, so I can understand you and so that we can understand you.
Sure, of course. Thank you. Yeah, thank you very much.
Yeah, absolutely.
So our family moved to the Philly area last August after 20 years in Houston, Texas.
Yeah.
Came here for work, and so my family includes my wife Dana, my son Evan, who just finished 8th grade, and then I have 2 daughters, Taylor and Brooke, that are college students at Auburn.
Very cool.
And as we were moving to this area, it's kind of coming close to home for me because I grew up in Bucks County, Pennsylvania.
Oh, okay, so you're homegrown.
So that's right, exactly. So it's kind of coming home in a lot of ways. But we didn't live in this area, so we were looking for home church. That was very important to us as we moved here, and we were really excited to find Church of the Saviour in Wayne, and started coming here actually even during our visits, recruiting visits. We came here once, and we're really excited to get plugged in and have worshiped here since moving and gotten involved.
Okay.
And then the position I moved here for is at University of Pennsylvania, a professor and director of biostatistics at the School of Medicine at Penn. And my position is as a statistical data scientist.
Gotcha. Okay, fantastic. So tell me a little bit about what that means, that you're a biophysicist that does statistical data science, and then how that's associated with coronavirus and COVID.
Sure, absolutely. So as a statistical data scientist, what people in our field do is we figure out how to extract knowledge from research data. And that involves working with doctors and biologists in biomedical research projects, as well as developing new methods for handling some of the complex data that we face in the modern world. And this process involves considering the source of the data, evaluating the quality and any potential bias in how the data was collected, synthesizing them together, and then drawing conclusions while figuring out how much uncertainty there is in our conclusions. Can we be fully confident, or is there a lot of uncertainty in what we've learned?
Okay. Really interesting. And I've spent a little bit of time since we talked about getting ready to do this interview. You have a blog that's specifically associated with the research on COVID-19. Can you talk just a little bit about that? And then let me let folks know. We'll put the link to the blog up on the Facebook page so that you can check it out later.
Yeah, so I started this blog page, COVID-datascience.com, and my goal there is really just as I personally sort through all of the information that's quickly accruing, I'm trying to sort through it, find what I think are the most important bits of information, and try and provide a balanced commentary on what I see going on, trying to maybe remove political narratives and other things that might make it difficult to fully understand the problem.
Wow, that's actually really important, isn't it? This has all been so politicized in so many ways that it's great to have a scientist just looking at the data and the science.
And I think there's a lot of things in our society that happens, and I think it's really important when we're evaluating the data to be aware of those things and set them aside and try and figure out what's going on.
Absolutely. Yeah, so let me say before we get into some more specific questions, for those of you that are joining us on Facebook, you are more than welcome to type a question into the chat, and we'll try to get to it. I can't promise we'll get to all of your questions, but I've got the chat open here, and as I see questions, I can sort of pop them over to Jeff, and he may actually answer some of them as we talk as well. So let's start here with just sort of a generalized question, but it sort of gets us into the COVID and the coronavirus stuff. So what have we learned about how COVID spreads?
Well, we've learned a lot since it first started, and the key thing is that primarily it spreads through respiratory and aerosol droplets from infected people. To a lesser degree, it can be spread through infected surfaces, but respiratory is really the primary source. And some of the other things we've learned are that it spreads much more efficiently indoors than outdoors. So it spreads especially efficiently in closed, crowded areas. And also, any activity where we're breathing hard can expel more virus if there's an infected person around. So that's another thing to keep in mind. And so a key principle to keep in mind is viral load, that you need to be exposed to a certain amount of it before you're at high risk for infection. So getting exposed to just a tiny bit might not get you infected, but if you're in an environment where you have sustained exposure, that increases the chance of you getting infected.
Okay. So now that we've moved into that yellow phase and we're getting close to green phase, which I don't know about the rest of you is confusing to me, but I know it's happening. What are some of the things that you would suggest from your expert point of view that we can do to open safely, like specifically as a church, but just in general opening safely and avoid catching the virus?
Well, I think a key thing is to remember what we've learned about how it primarily spreads. To be careful about indoor crowded areas, practice social distancing, especially indoors. Mask wearing seems like it can make a big difference in slowing the spread, and again, especially indoors. And practicing good hygiene and cleaning can also help. And I think that's the key thing, is these basic precautions that we're hearing. If we all take those basic precautions, then it's possible for us to stay safe even as things open.
Great. So this is just a question that just occurred to me. So if you don't have a specific answer, that's perfectly fine. But you're talking about the importance of mask wearing. And there's been some of that stuff out there about masks don't work at all. Masks are the most important thing.
Right. Well, the key thing, the bottom line is that masks help a lot. And if everybody wore masks, especially indoors, that might almost be enough to keep things under control. But the key thing is, early on, there was hoarding of a lot of things, including masks. And the frontline healthcare workers needed, especially the N95 masks that are the highest quality. So I think messaging was sent to keep people from hoarding them. And also, early on, I think we didn't understand as much about how it's spreading. And so since we've learned more, I think we realize masks are a primary tool we can use. And one of the things we've learned also that makes mask wearing more important is that, unlike a lot of respiratory illnesses, COVID-19 tends to spread from asymptomatic people. A lot of respiratory viruses spread when people are showing symptoms or just before, but it seems like this virus behind COVID-19 spreads for several days before anyone shows symptoms, and maybe even from people that stay asymptomatic. And that's why the mask wearing is especially important, because people can be going around asymptomatic, spreading it to people all around them. But if people are routinely wearing masks, in particular people who may be asymptomatic infected, then that mask is going to keep them from spreading the virus to everyone around them.
Gotcha. And so, as we're talking about masks, you and I are sitting here without masks
Right.
on, but we are socially distanced.
Yes.
I'm not sure if it looks that way on the camera, but we're maintaining safety as we do this. So, tell me, how do you think people, our congregation, should really like manage their fear, right, of getting back together, you know, in terms of I'm afraid of getting infected versus like I really want to re-engage with life? It feels to me like we're very much on one side or the other, right? That we're very afraid and we just want to hunker down for the next year and a half and never leave our homes, or we're ready to run out and hug everybody we see. So what do you say to both of those groups of folks?
I mean, I think it's essential for us to individually and as a society find that balanced ground between those two extremes, which are both very hazardous. So at an individual level, what I would say is people need to figure out which of their fears are healthy fears and which of their fears are irrational fears. Because I think it's very important to have a healthy fear of this virus because it spreads so quickly. And even though about 90% of those infected will either be asymptomatic and only have mild symptoms, a small proportion who are infected can get very seriously ill, and it does kind of nasty things to people when it's very advanced disease. So I think it's good to show caution. And I think people that are not taking those basic precautions might be continuing the spread. You see it some going on in some states right now. I think that's a lot of what is driving it, is people aren't taking these basic precautionary steps. But on the other side, I think we have to realize that this isn't like nuclear fallout. Like I know, like in our generation growing up, we feared nuclear war and thought, oh, if there's nuclear war, you got to stay in your bomb shelter for a year. And if you step outside for 1 second, you're going to die. And that it's not like that. Like we know how the virus spreads, and it is possible to go out and keep ourselves safe. And we kind of know in general what those steps are. So that's where I think we have to sort of figure out that balance, because sort of the other side of it is if people are too scared to go out, where it keeps them from seeking medical care for other issues, or if it makes them completely isolate themselves and hurt themselves socially, or maybe fall into a depression, you know, then that could be a very, you know, problematic thing. So I think people need to figure out a way to engage socially with others, but to do it in a way that is protecting themselves and others from the virus.
So it strikes me that part of this is, you know, I know how to be safe. I know how to wear a mask and social distance, but I can't control the behavior of others.
Right.
Right? And so when I'm out there in the world and people aren't wearing masks and they're not social distancing, there's some fear associated with that. Are there any kinds of particular things that we can do in those sorts of situations? I mean, is it just continuing to do the safe things for ourselves?
Yeah, I think, I mean, be mindful, and we can look around. I mean, there may be an unsafe environment. Like if there's a place that's really crowded, people aren't wearing masks, then just stay out of those places. And you know, we just kind of avoid the dangerous situations.
Okay, great. Thank you. So let's talk a little bit more specifically about coming back to church, right? You're all sitting on the edge of your seats wondering, what's that going to look like? When is that going to happen? How do we do it safely? So I'm guessing that many of you, I know I've seen it, there was that sort of popular article that went around for a couple of weeks, and it may still be floating around, where they sort of ranked the dangerousness of different kinds of activities, and church was pretty high on the danger list. So what can we do? Because we want to be back together, right? Physically as a congregation. We want to fellowship with each other. What can we do to remain safe as we move toward opening the church, and specifically opening COS?
Right, and I think that that danger is measuring based on how we usually do church, where we're completely packed in with no social distancing, you know, singing really loud, all indoors. And I think that based on what we've learned about how it spreads, I think there are, you know, some risks in that environment. So I think clearly we have to make some changes in order to make it safer. And I know I'm confident our church will do that. I know, talking with Pastor, the elder board is meeting tomorrow night and talking through this, and they've been very cautious all along about this, understanding the risks, that they want to do it as safe as possible. So I'm confident they're going to find a way to make it safe.
Thank you. So yeah, I mean, from my own point of view, be patient. We've got good people in leadership positions really chewing on this and praying about it and thinking about this and working on a plan. So we actually have a couple of questions on Facebook.
Yeah,
so let
sure.
me toss them at you and see what you think. So the first one is actually specific, but we've sort of dealt with it, but let me ask it anyway. So someone is asking, will masks be required? And if so, what happens if they arrive and refuse to put them on? Now, that's not your job to answer that question, but let's go back to talking about masks and their importance.
Right, that's right. Yeah, so exactly. The church will have to make decisions on those types of things. But I think if we have a lot of people all together, having masks would lower the risk tremendously, especially if we're indoors. Now, if somehow we can arrange to have, I don't know, like Bible study classes or maybe even service outdoors, then I think the risk goes way down. And so it might be possible to, it might not be as important to wear masks outside as it clearly is inside.
So it sounds to me like in our conversation, there are a couple of really important things. It's the social distancing, it's the mask wearing, and then even when we're outside, the risk is lowered. So it's also sounding to me like we have some options. There's a good deal of flexibility in how we might actually be able to do this.
For sure, I think so. And one analogy I heard someone make that might be helpful is, since this is a respiratory virus, people are sort of exhaling the virus, and that's where the risk is when it's lingering in the air. So you can think about what are the settings where if there was a smoker around me, the smoke would really bother me. So if I'm in an enclosed, crowded area and people are smoking, I might be choking, my eyes will hurt. That's also the settings where the risk is really high. If I'm in a big outdoor area and there's some space, someone might be smoking, I might not even notice it. Now, if the wind carries it down to me, I might smell it a little, but that kind of gives you an idea of a way to think through what are the settings that are more dangerous.
Okay, great. Thank you. I appreciate that. One other question that somebody typed here is, given that the particle size of the virus is known, okay, what does that tell us about the effectiveness of various mask types? Wow, that's somebody who sounds like they know their stuff.
Right, and I think this is part of why people came out saying masks aren't going to help you, because people that are working in very dangerous high exposure environments have to have special masks that don't allow particles of certain size through. And the cloth masks or even surgical masks do not have small enough holes, and some virus can get through. So in that sense, it's not perfect and completely protecting you from the virus, but it's still a sieve, and you have viral particles that are joined with droplets of things in the air, an aerosol, and so the mask is going to capture a lot of the virus and limit a lot of it. So for the wearer, it helps them some, because some virus might catch on the mask, but then of course you have to be careful about touching it. But where the masks really help are if I have the virus and don't know it, then as I'm breathing or coughing or you're sneezing even, it's not going out in the air, it's getting caught in my mask. And of course I have to be careful how I handle the mask, but that's the key principle. So even if you're wearing a mask that is a cloth mask, not a surgical mask, not an N95 mask, it's a good idea to wear it. And I think, one thing we're seeing in various types of scientific studies is in communities where people are largely wearing masks, the viral spread goes down and shrinks. And I think that's one of the key things we have to do societally.
Great. So I can't remember if it was on your blog or if I saw it on your Facebook page. You just recently shared an article with a visual of how much masks cut down on what you're expelling.
That's right. That's right. And that was on a blog post, and a blog post was also linking to an article that reviewed several papers. And as you can imagine, it's kind of a hot area of research. And I'd say every week I see 3 or 4 new papers coming out that are providing support for how important this is. And then when we see what's happening, there are surges going on right now in Florida, Texas, South Carolina, and Arizona. And from what I hear from people I know in these communities, mask wearing was at a very low level. And now they're starting to require mask wearing like we have here in Pennsylvania, and I'm hoping that will help get things under control there.
Terrific. Okay, another question came in. How can shared bathrooms be safely used? So, we've got bathrooms here in the church. We have a large congregation. Are there things we can do to make that as safe as possible?
Right. Yeah. I mean, I guess frequent cleaning is important for the surfaces that might be infected. Although one thing to keep in mind is it spreads mostly through the air, but in a high traffic area like a bathroom, there could be some. And actually, I've read where aerosol particles can actually be sort of caused by flushing the toilet and such. So I think if people are in the bathroom, they probably should keep their mask on, maybe for multiple reasons. So
Sure.
yeah.
I mean, why aren't we already just
Right.
wearing our
There you go.
masks in the bathroom, right? Yeah. So, and I will tell you that is something that has been part of the conversation as we've been talking about how do we open safely, is thinking about safe bathroom use and door handles and all of the myriad things that we need to be thinking about. I don't see any other, perfect. I just saw another question. Somebody just popped it up. And it actually goes to one of the things that you wanted to talk about too. How long do you think this will continue? How long are we going to have to continue with these kinds of measures and so on?
Yeah, I mean,
how long will it be with us?
Yeah, I think the first question is how long it's going to be with us. Unfortunately, it's going to be with us for a long time. So we need to sort of hunker down for the long haul. And that's why it's so important that we figure out what steps we need to take to be able to get most of our lives back, yet still take the key steps that are going to protect us and keep the virus from spreading out of control. So pretty much we've seen now in the summer the virus has not gone away like flu kind of does. So it seems like it's with us. It's very likely that as the weather gets colder and drier in the fall and winter, it's going to spread more. So I think it is going to be with us really until either we build up sort of a herd immunity, they call it, which would mean that maybe 60 to 80% of people have been exposed to it. Right now we're at 5 to 10%, so that would be a long time. Or until we have a working vaccine that's proven to be safe and effective and is disseminated throughout the whole community. And so the bad news is it's really hard to develop a vaccine against a virus, and it takes a really long time typically. The good news is that there has been unbelievable progress made very quickly. There's a lot of efforts in parallel, so we're not relying on just one effort. There's over 120 vaccines being developed right now. Many of them are already in advanced clinical trials. And so there's a chance that we may have something, if one of these early ones works, we could have something in the winter, which would be much faster than anything's ever been done. But something that is tricky about this virus, though, is getting a vaccine that is effective is especially challenging, because the way the disease kind of works is if you have advanced disease, typically what is giving you the more advanced symptoms and the life-threatening symptoms is not the virus itself, but it's an overactive immune and inflammatory response in your body towards the virus that is not effective in neutralizing the virus, but then it's that effect that causes the life-threatening symptoms. So if you have a vaccine that produces antibodies that recognize the virus but don't neutralize them, there's a chance that they could actually make it more likely for the person to get advanced disease. So that's why they have to be extra careful in developing the vaccine to make sure that the antibodies that it produces are going to be neutralizing antibodies. And so they really need to do the scientific studies carefully to ensure that before they roll it out over the whole society. Yeah.
So it sounds to me like what you're saying is this is going to be with us for a while, and we just need to be patient and do the safe things. We
do, and that's why I think, this message of finding the middle ground is not just a good idea. I think it's essential, honestly, for survival, because if we lock down for a year and a half as a society, there'll be nothing left when we come out, and the destruction that causes will be immense. So obviously we can't do that, but at the same time, if we want to just pretend this isn't with us, we're going to see it grow exponentially, and it's going to spread all over the place and cause a lot of death and a lot of illness. So it's essential that we figure out how to find this middle ground, and that's where I think the scientific studies and other studies that are learning very quickly are important, because the more specifics we can learn about how it's spreading and how we can control it, we can develop what I call targeted mitigation strategies that allow us to live our lives as much as possible but taking those key steps that are going to keep the virus under control, and then maybe we can manage it a similar way we manage the flu, the cold, and a lot of these other things that are always with us, but keep it from, growing out of control. Yeah.
So I want to be respectful of your time. It's Father's Day. We do have a couple more questions. Are you willing?
A little bit, yeah.
A little bit, I know.
Ask my wife.
Right.
Okay.
So his wife's birthday was yesterday, and he and I were on the phone preparing for the interview, and now he's here today on Father's Day. So thank you very much. So I'll ask these questions.
Quick, yeah.
We can go through them as quickly as possible,
Sure.
right? Okay, so one of them actually is not really one for you to answer, but I'll mention it. Has any consideration been given to having outdoor church worship services? And I will just say yes, that is part of what's under consideration, given some of what Jeff has said to us, that outdoors is safer than indoors. Did you want to add anything to that?
If we could pull that off, I would be really excited about that, because I would feel very safe. If it's indoors, we have to take a lot of steps, and I know some churches have done that, and so it would be good to kind of hear from the ones who have tried other steps to make sure that that's worked.
Got it. Another question. Do we know yet that if you have it once, you won't get it again?
We don't know for sure, but it seems likely that once you've had it, you won't get it again. But we don't know for sure, and I think not enough time has passed. And that is also a relevant question in terms of how well a vaccine will work. So I'm hoping the answer is yes, and it seems likely the answer is yes, that you're safe from getting it again if you've recently had it. But one thing is, sometimes it kind of lingers on too. Like, people recover in their symptoms, but then the virus, they maybe test positive again, but that doesn't mean that they were infected again. It might just be that there's a little bit left that is detectable sometimes and not other times.
Okay. So then, is there anything else, any last words that you'd like to share, anything that occurs to you that I didn't ask about that you think is really important to share with everybody?
No, I think I've hit the key points, and I think, the key thing for people to keep in mind is really just to be vigilant, but really find a way to live your life within sort of that safety. And one thing I'll mention is social distancing we've heard a lot about, and it's probably a poor choice of words, because we need to stay social, especially when we can't be close together physically like we usually are. We have to find creative ways, to connect with people we love and connect with others. So maybe we should think of it as physical distancing, but we should all think about, after, staying at home for 3 months, what are creative ways we can connect with people just for our social, emotional, spiritual health, okay.
I love that. Thank you. So one person asked if this is going to be recorded so it can be shared with others. It will be on our Facebook page, and you can share that at any point in time. So it will always be there for your information and to share with others. Jeff, let me just say, thank you so much. This guy has been incredibly busy over the last couple of months, writing and researching, and now doing lots of interviews and so on.
Here and there.
Because people trust and really trust his point of view, because it's so clearly research-based and, is coming from such a balanced place. And, I appreciate that. I will just share really quickly before I let Jeff go. As we were talking on the phone yesterday, I said, can I ask a personal question? I want to visit my mom and dad. Is it safe? And he convinced me that it is. And so we're going to go, my husband and I are going to go see mom and dad today. I haven't seen them for 3 months. And so I really appreciate that personally. And I'm sure that the folks that are watching today appreciate you talking about the fact that this isn't the end of the world.
Yeah,
that we can figure this out. We can figure out how to be safe and be in the world.
Absolutely.
Right?
Yes.
And be back together again in some safe ways. Jeff, thank you so much for being here today. We really appreciate it.
Sure. Thank you.
Thank you. All right, folks, have a wonderful week. We will see you next week for our worship service. And then after the worship service for our members is our Vision Day meeting. So make sure you stick around for that. Take care. Have a good week.